All right, so you take the test, it's positive, you're going to have a baby. It's an exciting, life-changing moment in a woman's life, but once the news sinks in, the excitement may be replaced with anxiety, and a lot of questions come to mind. How many weeks am I? When should I see the doctor? Well, our next guest can help with those questions. Dr. Rebecca Brightman is an OB/GYN and member of the Medical Advisory Board for a popular women's magazine. Dr. Brightman, thank you for joining us this afternoon. So,
thank you for having me.
You know, millions of people for millions of years have been having babies, obviously, but it's always interesting that when you find out you're going to be a mother for the first time, it's almost like you're in uncharted territory. What's the first thing that you should do when you find out you're pregnant?
Well, first of all, don't panic. It's very exciting, and it's a game changer. It really, really is. It's a very, very exciting time in a woman's life. And I think one of the most important things is obviously you may want to share this news with a significant other. And if this is something you haven't previously discussed with your health care provider, it's a good time to make that phone call and determine, you know, when should you come in for that first appointment? Are there certain things you should be doing? Are there certain things you should not be doing? So these are, you know, it's important. That first pregnancy test is really important.
Yeah, it sure is. Now, when you find out you're pregnant, you want to do all the right things. You want to eat right, you know, lifestyle changes. What are some of those changes that we should make right away?
Well, in general, my own personal philosophy and the philosophy I try to convey to my patients is that by having a healthy lifestyle, it's something they can really continue with and hopefully make an easy transition into pregnancy. But, you know, clearly once one finds out one's pregnant, you want to make some changes in terms of, you know, dietary changes. For example, if a woman likes to have fish in her diet, she may want to, you know, keep an eye on and be very selective about what fish she's having. There's certain fish that women should avoid in pregnancy. For example, fish that are higher in mercury. Shark, tilefish, mackerel, for example. She should limit or stay away from tuna. If she's having meat, make sure it's well cooked. Cheese, make sure it's pasteurized. You know, those are some of the dietary changes a woman should make.
What about caffeine?
I actually think that caffeine in pregnancy in moderation is okay. In general, excessive amounts and greater than 5 cups or so have been associated with an increased risk of miscarriage. But I had coffee during my pregnancies, and I think a glass or two of a caffeinated beverage or a cup or two of coffee a day is actually fine.
Okay. What about medications and vitamins? When should we start taking those prenatal vitamins?
Well, I think prenatal vitamins are important, and ideally if a woman can start taking prenatal vitamins before she gets pregnant, that's ideal, particularly because of the folic acid. Folic acid has been shown to decrease the incidence of certain birth defects. So if she's going to keep up with anything, it's the folic acid. In addition, if a woman's taking certain prescription medications, this is something ideally she should discuss with her health care provider before she even tries to get pregnant. But if a woman finds out that she's pregnant, which she now can find out early, she should then make that call to determine should she continue with medications or not, and also to address the fact, you know, what medications that are over the counter are okay for me.
Right, right. And you talked about women are finding out they're pregnant earlier and earlier. Sometimes it's even hard to figure out how many weeks you're pregnant until you get to the doctor. Is that right?
That's absolutely true. That's absolutely true. And now it's actually very exciting because women can actually determine how many weeks they are, estimate how many weeks they are post-ovulation. And having that information is actually very helpful. It's helpful for me as a physician because then taking that information, I can best determine how many weeks gestation a patient is, a woman is, and particularly in the setting of a situation where you have a woman with irregular cycles.
Now, in your, I guess, opinion, when's a good time to let the outside family know? You know, your cousins and friends and family.
I think it's a great question. You know, 20 to 30% of pregnancies can result in miscarriage. So I do think it's important to not share the news until towards the end of the first trimester. There's certain tests that we perform, and when they, you know, can ensure the fact that a woman has a viable, healthy pregnancy, I think it's totally fine to share that information. I think the risk of sharing the information earlier is in the event that there's an adverse outcome. The question always is, you know, do you want to share that with everybody? It's a very private, personal, tough time to go through. So I think the best piece of advice is to wait till the end of the first trimester.
All right, Dr. Brightman, thank you so much for all of that information. And of course, if you would like more information on what Rebecca discussed today, or for more tips for would-be moms, go to our website, delmarvalife.com, and click on the Show tab. So now that we talked about what to do before the baby arrives, what about after the new bundle of joy is born? For many women, they're cutting their maternity leave short and getting back to work as soon as possible. The National Center for Health Statistics reports about 2/3 of women in the U.S. are employed during pregnancy. But get this, studies show 16% of new working moms only take off 1 to 4 weeks after giving birth, while 33% took no formal time off, returning to work almost immediately. Now, it's a trend that appears to be on the rise. Just last year, CareerBuilder.com took a poll of about 800 working parents. The poll showed that 1 in 10 women took 2 weeks or less of maternity leave. The same poll for this year showed 1 in 8 women are taking 2 weeks or less of maternity leave. You may be wondering, why the rush? Well, research shows it all comes down to, you guessed it, the dollar. Numbers from the Pew Research Center show moms are the sole or primary source of income in 40% of households with kids under 18 years old. Too many families just can't afford to have mom miss work. But before jumping on this rising trend, there are a couple of things new moms may want to consider. Having a baby is a major event. Your body will need proper time to heal and allow your hormones to get back to normal. You may also want to look at maternity leave as a time to bond with your new baby. Studies have also shown that a shorter leave may interfere with breastfeeding, which has been proven to have so many health benefits for your child. Also, research has shown a shorter time off after having a baby may lead to higher rates of depression in new moms. Now, if you have questions about what's best for you and your family, you'll want to speak with your doctor. And if you'd like to read more about this new research, go to delmarvalife.com and click on the show tab. New baby or not, sometimes we could all just use a night out. Wouldn't it be nice to take in a great show? Well, up next, we're going to learn more about Clear Space Theater's production of The Foreigner. Find out where and when you can see it, plus what other shows are in the works. You don't want to go to the theater on an empty stomach. A little later, we're in the kitchen making a hearty stew. But first, we just learned more about women in pregnancy. But guys, the girls shouldn't have to do it alone. Dr. Oz has more on how you, too, can be part of the pregnancy.
Gone are the days when a nervous dad paced in the waiting room smoking cigars like Ricky Ricardo. Men are now an integral part of pregnancy. Here's a few ways fathers can strengthen the connection. Arrange for paternity leave. Attend prenatal visits and birthing classes. Exercise together and eat healthily. Ready the house and take care of childproofing. Build a support network to help with shopping, cleaning, and arrange for pre-cooked meals. Pack a hospital survival kit. Labor is sometimes long, so fathers should bring their own bag too. And do a dry run to find the best route to the hospital and learn how to work the gear, car seat, stroller, and diapering. And after the baby is born, why not make nursing a threesome? Dad can snuggle up with everyone, be part of the solution.